Headaches, types, symptoms, causes, diagnosis and treatment. Headache is one of the most common pain conditions in the world. For some people, continually battling headaches can lead to feeling anxious and depressed. Primary headaches are those that aren't due to another medical condition. The category includes cluster headaches. Secondary headaches are related to another medical condition, such as disease of blood vessels in the brain. Headaches have a tendency to run in families, especially migraines. In fact, kids whose parents have migraines are up to 4 times more likely to develop them too. Headaches can also be triggered by environmental factors shared in a family's household, such as eating certain foods or ingredients, like caffeine, alcohol, fermented foods, chocolate and cheese. Headache pain results from signals interacting among the brain, blood vessels and surrounding nerves. During a headache, an unknown mechanism activates specific nerves that affect muscles and blood vessels. But researchers think migraines result when unstable nerve cells overreact to various factors, triggers. The nerve cells send out impulses to blood vessels and cause chemical changes in the brain. What triggers headaches and migraines? Common triggers of tension headaches or migraines include alcohol use, emotional stress related to family and friends, work or school. Headache symptoms vary, depending on the type of headache you have. Migraines are the second most common type of primary headaches. Symptoms of migraines include moderate to severe pain. They occur 1 to 8 times per day during a cluster period, which may last 2 weeks to 3 months. People, and even healthcare providers, often mistake migraines for sinus headaches. Symptoms of sinus headaches include bad taste in mouth, deep, constant pain in your cheekbones and forehead, pain that gets worse with sudden head movement or straining. They happen when you frequently take pain relievers for headaches. Diagnosis and tests. How are headaches evaluated and diagnosed? If you have headaches often or if they are very severe, reach out to your healthcare provider. You can usually start with your family physician, where the diagnosis process will begin. It's important to diagnose headaches correctly so that specific therapy can be started to help you feel better. Your healthcare provider will complete a physical examination, discuss your medical history and talk to you about your headache symptoms. During the headache evaluation, your provider will ask you about your headache history, including a description of your headaches. The physician will look for signs and symptoms of an illness that may be causing the headache. Bacterial or viral meningitis, an infection or inflammation of the membrane that covers the brain and spinal cord. Keeping a journal of your headaches and how they make you feel can be helpful when you are talking to your healthcare provider. By giving your provider as much information as possible about your headaches, you're more likely to get an accurate diagnosis and a treatment plan that will help you feel better. However, if your healthcare provider thinks that your headaches are being caused by another medical condition, there are several imaging tests that may be done. Once you know your triggers, your healthcare provider can tailor treatment to you. Counseling and stress management techniques can help you handle this trigger better. They monitor your involuntary physical responses to headaches, which include increases in breathing rate. But be aware that using these medications too often can lead to a long-term daily headache. For frequent or severe headaches, your provider may recommend prescription headache medications. Triptans and other types of drugs can stop a migraine attack. Drugs for high blood pressure, seizures and depression can sometimes prevent migraines. Your healthcare provider may recommend trying one of these medications to reduce headache frequency. The key to preventing headaches is figuring out what triggers them. Recently, there have been several new advancements in our understanding of what causes headaches. Although we are closer than ever before to a cure, at this time there is no cure for primary headaches.